Doing well. Yes, ma'am. Who is that? No, I don't see her. I
But
don't.
this is her table.
Okay. Do you have another person? You could get Linda if Keisha doesn't show up unless it's somebody else.
Now, Marquita has that table. She's the facilitator for that table.
Okay. Well, I'm going to go ahead and get started because it's a little after 10, so we can
Oh,
go
wow,
and
I
get
didn't know
started.
that.
Good morning to everyone. We would like to go ahead and get started. Good morning again, and welcome to our Homelessness Roundtable. I believe this is the first one that our Department of Community Development has sponsored, and basically we just thank you for coming today. I am Cornelia McGee. I'm the Community Development Director, and want to just extend a warm heart welcome to you on behalf of the Department of Community Development. We are excited to have each of you join us today. Today will be a great day. We have with us Allie Card with the North Carolina Coalition to End Homelessness. We also have extended the invitation to you who are representing various agencies throughout the Twin County area. And we just look forward to having a great time sponsoring, talking about homelessness and what the various agencies in the community are doing to provide and to assist with addressing homelessness in the area. There are 3 tables that we have here, Table 1, Table 2, and Table 3. There is a facilitator at each table, and Ms. Allie Card will provide more instructions on that. What I'd also like to just share with you at this time for is restroom facilities. If you come out here to my left, there's the men and ladies restroom. We do have water in the back here. At the conclusion of the workshop today, we will have lunch, so please make sure you stop and get a box lunch before you leave. You're welcome to eat that box lunch here, or you can take it with you. At this time, I'm going to turn the presentation over to Ms. Card. Allie?
Thanks. Good morning, everyone. Thank you, Cornelia. Thanks for having me. I'm going to present a little bit about what NCCEH is and help kind of facilitate the conversation this morning. But I also want to acknowledge and recognize that you all are the experts. I live in Raleigh. I do not live here in Rocky Mount. And so we want to hear from you. We know that you have great things to say. And so I'll share kind of what we know from our lens and our perspective, but where you all come in is really vital and really important to this conversation. So I just kind of wanted to start there. So this is just our, can you go back to the agenda real quick? Thank you. So I'll just share again a little bit about NCCH. We're going to have a roundtable discussion, hence these great centerpieces that we have this morning. We'll talk about a little bit about homelessness, the causes, what we're doing about it, what else we can do about it, how we can really come together as a community and meet this issue that many of our neighbors are facing. We will then talk a little bit about local and federal funding. We know that's one way that we can really solve homelessness is increasing funding and making sure folks have access to more resources. And then we'll talk about what's next, right? We don't want this to be a one and done kind of conversation. We know that everyone here is really passionate about this issue and wants to continue seeing seeing strides being made across our community and really, really working to end homelessness. And that's going to take each and every one of us to work together and continue coming together. So we'll talk about kind of what we can do from here. Then we just have a really quick evaluation that I think we'll just probably put on the tables and everyone can fill out at their own leisure. And then we'll have lunch, which is great. So we'll look forward to that fellowship together as well. You can go to the next slide now. All right, so I'm going to say NCCEH because North Carolina Coalition to End Homelessness can be a mouthful, right? So whenever I say NCCEH, that is the acronym that I am referencing. Our mission at NCCEH is to uphold human dignity by pursuing justice and engaging innovative partnerships to end homelessness in North Carolina. So as an agency, as the name again alludes to, we are a statewide agency. However, we have kind of 3 different buckets of work that we do, so I'll go into that a little bit. We are a statewide membership coalition, so some of you might be, quote, members of the coalition. If you're not, check out our website. It's a very nominal fee to get kind of some additional resources and support from the agency as well, either as an individual or as an organization. We right now kind of average between 85 and 95 individual members and about 35 corporate members. We are really looking to grow that. We recently hired a development director, and she's going to be working on really forming more partnerships and relationships in the community so we can increase that coalition work. So our 3 main areas of work are the North Carolina Balance of State, Continuum of Care, and again, lots of acronyms. You guys live in this world, so you know it, but I will often call that Balance of State or the COC. So when I'm referencing that, that is the Balance of State, Continuum of Care. We also have the HMIS at NCCEH, that is our data center, and we also have a knowledge and innovation bucket, which really is saying everything else that doesn't fit in the other 2 categories. So in the next slide, this is just a map of North Carolina, obviously, right? But the counties that are in different colors are what make up our North Carolina Balance of State Continuum of Care. So a tad bit of history on what a COC is and why these 79 counties are a part of the COC. Essentially, HUD decided the geographies of a continuum of care, and essentially many of our more urban centers, so you can see actually like Wake/Raleigh, they're their own COC. Durham is their own COC. Orange County is their own COC. Buncombe County is their own COC. So there's 12 COCs across North Carolina. Everything else that didn't really fit into a more urban or metro area is what's called the balance of state. So hence, we are from the mountains to the sea, quite literally. And then we also find ourselves here in Rocky Mount. So you all are part of Region 9. I'm personally not great at geography, so look at the blue, Region 9, and we'll talk a lot more about kind of the data, both regionally and here a little bit more locally. So because we're 79 counties, that's really hard for 6 staff at our Balance of State Continuum of Care to kind of help manage and coordinate homeless services in 79 counties, right? So we have divided that up into 13 different regions, again, of which y'all are a part of Region 9. So the Balance of State, our role really has a lot to do with what HUD has regulated and what we need to do kind of on an annual basis. So that first piece is we help facilitate the annual Emergency Solutions Grant and Continuum of Care funding competition. So these are the 2 main federal programs that are really aimed towards folks who are experiencing homelessness. Both are facilitated through HUD, the Department of Housing and Urban Development. The COC grant, I'll talk a little bit more about both of these, but the COC grant is somewhere around like $12 million for the entire Balance of State. And our Emergency Solutions Grant, I think, is between $2 and $3 million right now. So we're looking at about $15 million to end homelessness across 79 counties, right? lots of money, doesn't go very far. We'll talk a little bit more about that, and I think that's why resources are really important to come into play as well. We also help conduct the annual point-in-time count, which I'm sure many of you, and I know some of you, are a part of on an annual basis. And this is really the count that every COC is required to do at least every other year to send data up to HUD and ultimately to Congress for them to have a picture and an understanding and a snapshot of how many folks are experiencing homelessness across the entire United States. It is one night, and it's based on that one night count. We know it is not fully accurate. We know there are a lot more data sets that we need to look at in order to have a full picture of who is experiencing homelessness. The folks that we count during point in time are all literally homeless, which means they are sleeping in a shelter or in a place not meant for human habitation, or they're in some type of rental assistance program that's for folks specifically experiencing homelessness. So we're not counting folks who are doubled up or folks who are paying to stay in a hotel. And that's one of the differences between two different federal departments. The Department of Education does have that more kind of open definition around homelessness. So I think that's something that is definitely relevant to the conversation as well, is who can we actually serve? Who are we actually counting? How is this number really not always an accurate reflection of the population that we're trying to serve? And then the balance of state, we also have a very robust support governance structure. So we have a steering committee, which people from all 13 of our regions are representatives on that steering committee. They really make all of the main COC decisions throughout the year. We've got lots of subcommittees. I think there's 5 of them, and a lot of different work groups. So the COC is very busy, and our job as COC staff is really to help facilitate those meetings, support those members of the steering committee, and just make sure that things are running fairly smoothly as a COC, doing minutes and making sure the communication is happening across those 79 counties. And then we also do a lot of training. So we do events like this, which honestly, since the pandemic, we haven't done much of. So I personally am grateful to be in person today. I think that goes a lot further than our virtual environment right now. But we do some training with emergency shelters and street outreach programs, rapid rehousing, mostly are projects that are funded by either ESG or COC. But we do a lot of training throughout the year. So that's the role of the COC. And then we'll just shift a little bit to kind of the second bucket of what NCCEH does. And obviously, I'm on the COC team, right? I'm on the Balance of State team. So everything else I say about the data center and whatnot is my limited knowledge of what my colleagues are doing. But the data center administers the Homeless Management Information System, or HMIS, for Durham, Orange, and the North Carolina Balance of State COCs. So they're helping really collect, manage, use population and service information. They are, if you're an HMIS user, they're on the other side of our HMIS help desk, supporting users who are in HMIS. And as flawed as we know data systems are, and as you know, HMIS doesn't always do what we want it to do, it is our main data source. So actually all of the data that I'll be discussing today comes directly from HMIS. So that's users who are putting information, providers who are putting information into this system, and we are extracting that data so we can better understand this population, where folks are moving, the resources that are available, et cetera. And we have really strong staff in our data center. They provide really great training, ongoing support, and are just always there for our users. So that's the second bucket of what we do. And then the third bucket is what's called knowledge and innovation. This, I think, personally is one of the most important things of what we do We have a program called SOAR, which stands for SSI, SSDI, Outreach, Access, and Recovery. We have a statewide contract with the Department of Health and Human Services to help facilitate SOAR across all 100 counties of North Carolina. And SOAR, kind of to what it alludes to in the acronym, is getting folks who are experiencing homelessness quickly connected to SSI, SSDI. Many of you know the process to get SSI, SSDI can be years long. And if you're homeless and you don't have an address, it's even more difficult. So SOAR is a specific program to support folks who are homeless, who are eligible for SSI, SSDI. They have, if you ever, you should look up SOAR because it's an amazing program. They have like an 85% success rate in the first go around. And so Sarah McMurray, my colleague at NCCH, she manages that program. And I don't personally know if there's any SOAR workers in Rocky Mount. You all probably know that, but some of our more rural communities don't have a great kind of coverage with SOAR, so that might be something to look into as well if we're acknowledging and recognizing that there's a population here in your region that could really utilize that support. We also, under Knowledge and Innovation, have a Housing Connections initiative. This is a grant through Blue Cross Blue Shield, where we're really helping kind of lower barriers to housing. We have a couple of grantees who actually are not part of Balance of State. So I think Charlotte and Buncombe County right now are the two that are funded. But they are doing essentially landlord engagement and recruitment, and we're learning a lot. And we're really hoping to use some of that knowledge that we've gained to kind of create a whole new landlord engagement system across the entire state, and really working together and acknowledging the needs of our landlords and knowing what speaks to them, how we can support households, how we can support landlords. There's just a lot of really strong work happening there. Then we also have a family diversion pilot, which is also one of my projects, so I'm really passionate about it. But we received a grant from the Bezos Foundation. Jeff Bezos, Amazon guy, pretty famous. We got $1.25 million from their foundation to help end family homelessness across our Balance of State. So we are really focusing our funds on diversion. So that's really more of a front door kind of intervention. So you may have heard of prevention or eviction assistance. Diversion is really kind of that front door, like once a household is about to experience homelessness, what we're trying to do is, rather than they call the shelter, we let them into shelter, then they're in shelter for 90 days, then they maybe get a resource and get rehoused. We're really meeting them at that front door saying, what can we do to get you back into housing today or tomorrow or next week? What can we do so you do not experience homelessness, but rather you're able to maybe move back with your aunt or move out of town because you have a family member you could go live with, or maybe you just need, your first month's rent and deposit. Let's get you into a unit instead of coming in to the homeless system. We know that it can be traumatizing. We know it's especially traumatizing for children and really creates a lot of lifelong challenges for our kiddos. So this project is in the second year of 5 years. So we're calling it a pilot right now, which means we get to shift and kind of change as we learn. Right now we have 3 sub-grantees through that. They are in Region 2, 3, and 7 of the Balance of State. And again, we're just learning a lot through that process. We also, and this is a quick little plug, help facilitate the Bringing It Home conference, which is next week on Tuesday and Wednesday. There's some great sessions that are happening. If y'all want the website for that to sign up, it's $50. There are 2 full days virtual conference across the state. There's a lot of really great sessions that are going to happen. And then we also do training and advocacy, 2 areas that we're really trying to grow in. We know that change can only happen when policy change happens and when more funds come through, right? We are not here to continue with the status quo. We need to change things. Homelessness has been around since the 80s as we know it, and 30 years later, more than 30 years later, it should no longer exist. We know how to end homelessness, and so we need to do it. We need to come together as a community to make that happen. Any questions about what NCCEH does? I know it's kind of this like monolithic, like big agency. Yes.
It's a very rudimentary question. What is SSI, SSDI?
That is a great question. Social Security income, Social Security disability income. So it's mostly for folks, and I always get the difference wrong, so if anybody knows the difference. DI, I believe, is for someone who has worked, like has a work history, but can no longer work anymore due to a disability. So that's actually a higher income. And then SSI is, you still have to prove a disability, but you haven't necessarily like paid into the system. So it's a lower amount. I think it's like $841 a month, I want to say. So it's not a whole lot, right? Like we're not talking about a livable wage by any means. And you can work kind of part-time if you get SSI or SSDI, but just like any other benefit, there's kind of like that cutoff, right? That like cliff effect of if you're making too much, then you no longer are eligible. But it can be life-changing for folks, especially if you have a housing resource that's helping with your rent. You know, you could live off of $841 a month. It'd be tight, but yeah, great question. Yeah.
Can you tell me how much is the federal government allocating funds for alleviating homelessness, and how much is North Carolina's share, and how much is the city's share?
Ooh.
That's number one. Number two is, what are some of the organizations that have donated, and how much have they donated?
That's a great question. So again, my lens is going to be a little bit like broader than Rocky Mount. So I might turn over your second question to Cornelia for later. We're going to talk a little bit more about funding. And I might get this off by a little bit, but the federal government allocates about $2.5 billion a year towards homelessness, which if you look at our federal government's budget, that is this much. And then North Carolina, I can really only speak to the balance of state. We get about $15 million between ESG and COC. We are, I think, by far the largest COC, so that's a pretty big chunk of the funding that North Carolina gets, but I can look that full answer up for you as well. As far as local goes, it gets a little complicated because for ESG, we have what are called fair shares for each of the 13 regions within balance of state. So we have to take that between that $2 and $3 million. All of the 13 regions get a very specific pot of money. Do we have any providers from Region 9 who know what that is this year? Looking at you. No. It's usually between like two, yes.
Okay, I have a question.
Yeah.
This is dealing with a senior that's homeless. Does your program also work with them?
Yeah, so the COC works to coordinate homeless services for everyone who's experiencing homelessness, from 0 to age whatever. There are specific resources that are for our senior population that sometimes are a better fit than some of our funded programs through the COC, but absolutely. We're seeing this across the country, right? We are an aging population. More and more boomers are starting to become elderly and need more affordable housing. So this is an issue that is not going to end anytime soon. Absolutely.
Right now, she's living with me, and my home is not designed for seniors. So I'm very concerned about her living in a condition here.
Yeah.
She's not elderly.
Yeah. Let's chat afterwards, and we can try to come up with some ideas. There's I don't know the name off the top of my head, but there's a resource that's close by that works with seniors specifically. So maybe we can get y'all connected there. Yeah. All right. Yes. One more question. Go ahead. Yes. Absolutely. Yes. So, So United Way does not receive any of those funds. So let me think off the top of my head. I know the Reach Center receives receives ESG funding. Y'all get COC funding now? Yay, that's great. Community Link has a permanent supportive housing project. Hand Up Ministries has ESG funding. Who am I missing? Do you know, Trishonda? Ripple Effects, thank you. They get a street outreach grant through ESG. And ESG, like I said, has a regional fair share amount, whereas the COC does not. So if we get no applications from a region, that region won't get any COC funding. So it works, it's a little bit different from ESG, and it gets very complicated very quickly. Yes, somewhere on our website there is. I will make sure to add that resource. Yes, and the HUD website, but you don't want to go there. Yes, sir. One more question. Yes. Good to see you.
There's fair share for Region 9 is right around 200,000.
Thank you.
Appreciate it. They were correct in Reed Center, Hand Up Ministries, and Ripple Effects. Street Outreach is Ripple Effects.
Yep.
Reed Center does actually rapid rehousing, and Hand Up Ministries does emergency shelter.
Yes.
So in terms
Thank
of
you.
The North Carolina Department of Health and Human Services Emergency Solutions Grant, we provide $5 million to the state of North Carolina, and as Ali mentioned, $2+ million of that goes to the balance of states simply because of the 76 counties that they serve. But as overall, speaking for our office, we provide $5 million across the state of North Carolina, $5.3 million this year to be exact.
Thank you so much, Chris. You might have to come up here later and talk about ESG and answer all our questions. All right, thank you. I think we'll move on a little bit. I've just got some data that I wanted to share. And I apologize, this is small, so I'm really glad that we have these printed out for you in front of you. So is there one before that, or is that? Weird. Oh, I switched the order. That's what happened. All right, thank you. You can go next. Okay, yes. So, again, we're going to hone into Region 9, right? We're going to talk about Region 9, and we're going to talk about the twin counties. That's what you call the Nash and Edgecombe. I didn't know that. I'm learning new things every day, right? So these are just some infographics. This is all from the 2022 point in time count. So this was last January. Our 2023 count did happen a few months ago, but our HUD deadline to submit everything is this Friday. So I don't have new info for y'all, but we'll hopefully have these infographics for 2023 in the coming months. So this is just showing the rates of homelessness throughout the community. And again, Region 9 covers Edgecombe, Franklin, Granville, Halifax, Nash, Northampton, Vance, and Warren counties. But as you can see, the highest rates of homelessness are really concentrated in Nash, Edgecombe, and Vance as well. So this is just, again, kind of a high level showing where we're seeing the most folks, again, who are identifying as homeless, literally homeless, on that one night in January. So a snapshot, this is one night, the folks that we've been able to count in shelter and those who are unsheltered. The next one is going to show us, yeah.
2022 point in time count for all of North Carolina was?
All of North Carolina, I do not have the number off of the top of my head. I can tell you the balance of state. I can't even tell you that. I'm going to look that up after this. Yes. Love it. For the entire state? 9,300 for the entire state. Thank you so much, Chris. You're going to be my data knowledge brain right now. So again, this is honing into Region 9 specific. So on the one night in January, 146 people in Region 9, which is also called the Tar Heel region, experienced homelessness. So 146 in this entire region. Of those folks, 1 in 18 adults identified as veterans, 1 in 9 were chronically homeless, which means that someone was homeless for more than a year, and they were experiencing some type of disabling condition, so either a physical or a mental health challenge. And then 1 in 18 adults are domestic violence survivors, and 1 in 4 are children. One other thing about the point in time, so when I'm saying domestic violence and chronically homeless, these are all self-identifying identities. So someone might have a diagnosable disorder, but they don't identify themselves as chronically homeless. So again, it's limited, right? Because we're not doing like a psychosocial exam and then deciphering how many people are chronically homeless. This is asking a household who's homeless very general and specific questions, but essentially the question they're asked is, are you chronically homeless? Sure. Like some people aren't going to know most people aren't going to know what that means because that is such a specific question. So again, taking all of this with a grain of salt. So that bottom piece there is showing kind of the breakdown of where folks were staying on that night where we did the point in time. So 51% were staying in emergency shelters, 40% were in transitional housing, and 15% were unsheltered. The next slide is going to show us more specific to oops, sorry, I lost my thought here. All right, this is a racial breakdown. I think this is always important to center, right? To center equity, to center the conversation around race and what we're seeing as trends in our community. So this first kind of block of information is showing Region 9's population. So that was the 9 counties that are a part of Region 9. The overall population, so that's from the census, and we just take it as it is on the census. So 48% of folks in Region 9 identified as white, 41% identified as black, and then the rest of the population was the remaining 11%. Whereas Region 9's population of folks who were experiencing homelessness on that point in time night, 9% were white, 84% were black, and 7% were the rest of the population. So, and that bubble to the right, to me, says it all. But Black Americans are 11 times as likely to experience homelessness than their white counterparts in Region 9. I think it's important to let that sit with us. We know these things, but when the data is right in front of us showing the reality, we know this. It's a cross balance of state. This is a very stark difference between 9% white and 84% black in our community. We know this, and we need to change this. This is why prevention services and support and resources can go so far in our community. And obviously, I don't have any perfect silver bullet answers to any of these things, but I think it's relevant to the conversation that we'll have today, right? And as we try to center racial equity in the conversation, it's helpful to know the data. So this slide is just showing more specific to Nash Edgecombe, whereas we've kind of been talking more about Region 9 as a whole. So this is showing that 109 of the 46 people in Region 9 who are experiencing homelessness on that night in 2022, they were experiencing homelessness in Nash or Edgecombe counties. So that's 75% of the households within Region 9 were specifically in these 2 counties. And then the next piece is about the actual shelter availability. And again, this is really small, so hopefully you can see it here. I tried to make it as big as I could, but part of what we do for the point in time, the other piece of it is called the housing inventory count. And that's where we actually get the actual real-time data and numbers of how many units were available in shelters and housing projects, and as well as how many people were sleeping in those beds and units. So this here is showing us both the beds that were utilized and the units that were utilized on that night of point in time. So, and this is our exhaustive list of shelters that we know about at Balance of State. If there are ever additional shelters that come online or other resources that we need to know about, please let us know, because across the Balance of State, we've got hundreds of providers, and it's hard for us to know if a new shelter comes online unless we hear about it. So this is our current exhaustive list of shelters in Nash and Edgecombe. So the Mercer Foundation, My Sister's House, Ripple Effects Group, and United Community Ministries. I don't know, yes, I might be missing one. But this is what I have on our housing inventory count. So 147 total emergency shelter and transitional housing beds were for people experiencing homelessness in Rocky Mount. So that's, again, the total number of beds and units that were counted on that night. And then this next slide is going to show us the permanent housing inventory. So whereas the previous slide was all shelter, this is going to be permanent housing. So either permanent supportive housing, or here we have emergency housing vouchers, which came online in 2021. We also have a couple of rapid rehousing projects, including SSVF, which is the Supportive Services for Veterans and Their Families program. And this is for all of Region 9. We can't bring this down to a county level because all of these projects are funded on a regional level. So we could go into HMIS and kind of do the count manually, but this is the easiest way to show that bed availability. So that's why the bed availability is pretty high here, or seemingly high for Region 9, because it is all inclusive of the entire region. I just threw a whole lot of data your way. Any questions or thoughts? Yes.
You're not, the numbers you have here are not counting for people who are homeless but living with relatives?
Correct. Correct. So again, the definition of literal homelessness is someone who does not have a safe and consistent nighttime residence. So they're either staying in a shelter or they're unsheltered, so living outside or in a tent, etc. Yes, Chris.
The only reason I can ask this, I literally just did a conference a few weeks ago
Uh-huh.
with these numbers, and I have the number for the state. The number for homeless children in North Carolina is at 22,000. And that's because those children, those households are counted differently from the literally homeless. They're counted for individuals, for families that are living in hotels, that are doubled up, or are living in situations that doesn't fit HUD's category of literal homelessness. So I don't have our area's numbers, but for the state, that's just homeless school-age children at 22,000.
I appreciate that addition, Chris. Yeah, so the department,
A little hard of hearing.
Yeah.
Is there by any chance a microphone? Because I was fascinated by what you're saying, but I didn't catch everything.
I do not know.
I was,
Do we have another microphone or just this one? Okay.
I was just saying, her question was about homeless statistics in North Carolina. I have the statistic for the 9,000 for the state of North Carolina, and for the state of North Carolina as a whole, school-age children, the number of homeless children is 22,000 in 2022. And the reason being is because the numbers are counted differently for school-age children and homeless families. It's different from the literally homeless definition that she's given. It is more so those that are doubled up in hotels, living in situations with other families. That's how those numbers are calculated.
Yeah, so that's through the Department of Education, which has a very different, just a more inclusive definition of homelessness. And it's my understanding that those numbers are also a cumulative number throughout the school year versus just that one night snapshot, which again is important to look at various forms of data, right? We have this 9,000 number, but then we have this 22,000 number. Like, those are very different. And we don't need to necessarily reconcile those, but recognize that we're looking at a population that's quite significant in our communities. Yes.
I'm looking at the sheet that you provided for Natchez County Permanent Housing Inventory.
Mhm.
And I noticed that the majority of the agencies, they do reference how many beds are available, but I don't see anything for Trillium Health Resources. Even though they're listed, I don't see anything for the beds with children. There are zeros beside their name. So is there a reason for that, or what services are they providing if they're supposed to be providing permanent housing inventory? I don't see any statistics saying how
Yeah.
many beds there are.
Yeah. Thank you for adding that. So my short answer is that back at home, rapid rehousing, that was through Emergency Solutions Grant COVID funding, which was, it's still kind of going on. And again, Chris can speak to this a little bit, but Trillium was funded. They're an LMEMCO, and they cover kind of the whole northeast part of and southeast of North Carolina. So their focus actually was less on Region 9 and more in other regions. And you can see just above them, the Reach Center was also funded with that back at home funding. So I don't know if there was maybe an agreement with y'all that you were covering Region 9 versus Trillium.
Some of the, where they have Northampton County, so we was helping to cover some of Northampton County,
Okay.
with some of their
Yeah.
needed housing.
Yeah. So it was really just more kind of logistics because Trillium covers, I think, like 4 or 5 regions of balance of state. So they were covering different regions, whereas the Reach Center was covering Region 9. I hope that answers your question a little bit. Yeah.
For some reason, my organization name wasn't there.
Leonard. I knew it was yours, and I don't know why. As I was going through the housing inventory count, some of our shelters were listed in the wrong region, and I don't know how that happened. So I tried to get them all on here. Would you like to share how many beds your agency has?
I have 8 beds.
8 beds. And are they always full? Yes, they're always full. You only serve 8 people?
That's all I have right now.
I swear
If I get
you.
some more funding,
It sounds, whenever you talk, it sounds like you have a much larger program than that, because you're just such a great advocate for your folks. If you don't know Leonard Tillery, get to know him. The Lighthouse. Okay, I would love to chat. Huh?
8 beds.
Okay, all right.
I have a question
Yeah.
about the address and being homeless.
Mm-hmm.
Doesn't it shift in documentation because the definition changes? Because sometimes it says you have to have a physical address, permanent address, in order to fill out documents, in order to say that you're, living
Mm-hmm.
society.
Mm-hmm.
You're not homeless.
Yeah, it's going to depend on like what you're applying for and what kind of resources you're looking for. Before this job, I ran a shelter in Denver, Colorado, and we just like use our physical address. That's where you're staying right now. So that's the address folks had on their IDs for probably many years after they left our shelter, honestly. And it'll usually work. We're also trying to partner with, I know this is just DMV specific, but we're trying to work with the DMV to lower their barriers to getting an ID when someone is homeless. I can't say that it's going super well, but we're trying. So we know, again, that's an area of advocacy, right? If you don't have an ID, but you don't have an address, how can you get a job, right? How can you get really anything in this society right now? So many barriers, absolutely. Yes.
Is there any way that we can get contact information on all these outreach centers? Because I'm work with the Department of Social Services, and the only referral that we have is the Bassett Center.
Mm-hmm.
So we just send clients to the Bassett
Yeah, yeah. Absolutely. I think that's a great idea, having some kind of like community-wide resource list. That's something I would be happy to help facilitate. Yeah, absolutely. Great question. Yes.
Okay, again, a rudimentary question. What is the difference between shelter inventory and permanent housing inventory? And what do these columns mean? Beds, units,
Yes, great question. I should have made it a little more accessible. So, beds for households with children, units for households with children. The HH stands for household. So essentially, it's showing households with children, households without children, and then CH stands for chronically homeless beds, and then the veteran beds are the households without children. Emergency shelter and transitional shelter. So all of these are what HUD's definitions are again, right? So if you're running an emergency shelter, but you're like, oh, it sounds like we're not emergency shelter, don't panic. This is just how HUD likes to define things, right? So emergency shelter is going to be like a night-by-night shelter up to, usually it's around 90 days. It's different for every shelter, but essentially it's just categorized as an interim kind of place for someone to live. Transitional housing, for all intents and purposes, is similar, but usually it's a longer length of stay. And then with permanent housing, so the permanent housing that's listed here, permanent supportive housing, is both rental assistance and supportive services for a household, so case management essentially, for as long as that household needs. So PSH, or permanent supportive housing, is our resource for the most vulnerable households who are experiencing homelessness, those who have been on the street for quite a while, those who are living with a disability or a mental illness of some sort. And then rapid rehousing is a shorter term rental assistance and supportive services program. That can be up to 24 months. Generally, our programs are between like 3 months and 12 months, I would say. So it kind of depends on the program, but essentially permanent supportive housing and rapid rehousing are getting you into your own unit where your name is on the lease, and then that rental assistance is just kind of subsidizing your lease on a monthly basis, whereas emergency shelter and transitional housing is usually you're in a building owned by the nonprofit and they're managing that space.
Is there, for the permanent housing, there is a time limit you can be in that program, or that can be indefinite?
So, yeah, so rapid rehousing is, there is a cutoff, but then permanent supportive housing could be forever. You know, we could talk about that as well, but it could be forever assistance. Yep. Yep. All right. Yes.
Do you have, let me just give you an example, right? I'm a physician. If I see a patient and the condition of the patient is now, I want to know what's the trend before in order to find out if the patient is getting better or not, right?
Mm-hmm.
So my question to you is that, do you have a 10-year trend of house homelessness? And if that's the case, can you track it down to evictions, COVID affected, joblessness, etc.? Is there any kind of data regarding that?
I wish. Our HMIS system right now, what HUD has us track is called returns to homelessness. It's one of our main, one of the items that of 6, I think, that we have to send to HUD every year, showing what our returns to homelessness rate is, but that's only a 2-year period. Right. So, no, but I know that our data center is partnering with a lot of different agencies right now to do some more data work and really to look at that kind of like cross-sectional, cross-system, folks coming out of the emergency room, folks who are in psychiatric care, in jail, like what their history looks like, and how we kind of fit into that. So no, I think one of the challenges in our work is that there's not a lot of great data out there. There just isn't. And the nature of it, the population that we serve is hard to to know where they've been, because sometimes they don't know where they've been, right? And trying to ask where folks have been in the past 10 years or where you've lived, you know, it can be a challenge. So I don't have a great answer for that, but it's a good question. That's for sure. Yes.
I'm with the Housing Authority City of Rocky Mount,
Great.
and we have two main programs, public housing and Section 8 program. Particularly for the Section 8 program, we've worked with some of the organizations that you have listed. Some of the challenges with individuals that have vouchers is you know, getting the landlord security deposit, kind of moving in first month rent, furniture. And so, can you just kind of talk about how we can better leverage the resources to make sure to get to families that need that?
Yeah. I think partnering with different agencies is definitely key there. Wish y'all got emergency housing vouchers because those covered all of those. Are you familiar with the EHVs? We need universal vouchers that come along with supportive services, because you know this and you just said this. If a household doesn't have that deposit to move into a unit, what good is a voucher, honestly? So it can be a really big challenge. I would connect you with the Reach Center. They're a great resource in the community that helps folks move into housing. Again, I'm not from Rocky Mount, so I'm not as familiar with the local resources, but I know in my experience working with housing authorities and running an agency, partnering with churches and other local organizations that can kind of help on a, one-time basis or support with, a portion of the rental or the deposit and helping on behalf of the household. But it's tough. I think it takes a community, right? And oftentimes it takes a lot of private funds because not a lot of the funding that we have from the federal government can cover furniture and other move-in kind of essentials. So that's definitely a gap that we see for households. And something I saw as a provider all the time, we had a household, get into housing and they didn't leave shelter because they didn't have a bed to sleep on. So, which makes sense, right? I'm not gonna make you sleep on the floor. So what resources can we connect you to? I don't know if there's any local nonprofits that do household goods or furniture. I think those are always great. Yeah.
There are. There's
Yeah.
an organization called Sleep in Heavenly Peace. You sign up, it's free, shpbeds.org.
Love it.
For kids. Any kid who doesn't have a bed, you sign up, and as soon as they get a bill, they will come and give you a free bed for each child, mattress, bedding, everything.
That's amazing. Very cool. Thank you.
shpbeds.org.
Thank you for that resource. Yeah.
shpbeds.org. And anybody can sign up, and it's for kids, so I think 18 and under.
Could you say it in this direction too?
Sorry, shpbeds.org, it's Sleep in Heavenly Peace. And there are chapters around in other counties, like Martin County, there's some in Charlotte, they're all around in Durham. But it's for kids with no beds.
That's awesome. Thank you so much. And actually, I think you'll have some opportunity to talk a little in your groups as well about some other resources that might be available. And I'm definitely hearing that the community wants to collaborate and hear what other resources we can kind of pull together. So if that's the direction your conversations go in, that's great. This is for you. So we are going to shift now. We're going to shift gears into our roundtable discussions. So get ready to talk. You've heard me enough. We are going to break into our groups. Each of the tables should have a leader who has been designated before today. So they will help facilitate. We've got 3 questions that we're going to talk through. If before you start the conversation, if you could just delegate someone to be your scribe, so someone to write your thoughts and answers on your little sticky pad, and then also someone to report out who would be willing to share with the full group kind of the highlights and summaries of what your group came up with. So you'll decide those 2 different people who will support the process. Use your sticky charts to write your answers. And we're going to have 3 questions. We'll start out, everyone's going to do question 1. We'll talk about that for 10 or 15 minutes. It's a lot easier than doing this virtually like I had to do in a meeting last week. So once the conversation starts dying down, I will bring us back together. We'll kind of discuss the answers that y'all came up with, and then we'll do that 2 more times. So that's how we're going to spend the big portion of our time together now. So the first question y'all are going to be discussing is, what are the leading factors that cause homelessness?
So question,
Yes.
every table will do question 1?
Yes.
And every table will do question 2?
Oh, is that not how? Okay, that's how I planned it. Yes, unless you'd like us to shift, that's fine too. Loretta, is that okay, or? You can say no. I'm more than happy to. I don't know if we'll have time to do all 3 anyway, so we can do that. Yeah. All right. So group 1, you're going to talk about the leading factors that cause homelessness. Group 2, you are going to talk about the common myths and facts that are surrounding homelessness. And then group number 3, you will talk about what have you seen as some solutions to homelessness in your community. Yes. They're asking for their leader. Is everyone crystal clear or clear as mud? Okay, thank you. Sorry, I didn't realize that's how you wanted it.
Good morning to everybody. The first thing I'd like to do, is to get everybody to go around the table and just tell us your name and where you're from. And then after that, we're going to do a quick warm-up exercise. We'll take it for a couple of minutes, and then we'll get right into the question. Okay, I'll start it off. I am James Mercer. I am from Battleboro, North Carolina. Okay. Name? Where are you from? What was that again?
Okay, so our task is to come up with common myths and facts surrounding homelessness. Now, we will need someone to record us and be the person that will tell what this group is. So what I'd like to do now is first, let's write.
Okay, all right. Everybody's here from right now, local people. So,
Oh, no, I know all of it. Let me tell you, let's start here. Who you are and
know one another a little bit before we get into the question. Because I want you to write down 2 things that are true about you. Two things that are true and 1 thing that's true. 2 true and 1 lie. You got a minute. Write it down. 2 truths and 1 lie. Write down 2 truths and 1 lie about you. About you. And then we're going to go around the table. I'll start it off. We're going to write down 2 things that are true about you and 1 thing that's a lie. And we're going to try to figure out which one is a lie. Okay? Yes. Yes, we got 15 minutes. We got 15 minutes for 1 question. If we had all 3 questions, we could do it. Okay? Just a quick, it won't take us but a minute to go through this. 2 truths and 1 lie. I'm Terry. Good. Hold on to it. 2 truths and 1 lie. 2 things that are true about you and 1 thing. Okay, I'll start it off. Okay. I am a high school and college basketball and football referee. I own referee apparel store, number 2. And number 3, I used to jump out of airplanes. Which one of those 3 things is a lie? I do own a referee apparel store. I sell referee. I never jumped out of airplanes. I went to the military for 36 years, never jumped out of airplanes. All right, so let's go here. Quick.
We're gonna pause it. So, on your pad, let's first write myths. Myths surrounding homelessness. What are some? What are some things you all said about homeless people? Think about what you said.
We have to figure out which ones are
See
lies.
somebody laying out under a tree or.
Let us figure out which one is lies. Tell us 3 things.
What did you say? Or what
3
came
things,
to
2
your
truths
mind
and 1 lie.
about homelessness?
Okay, we'll come back.
So write
Let's go right
down,
here.
first of
2
all,
truths
your
and 1 lie.
myths. Right? Now, who's gonna have reporting on?
We've got to figure out which one. You just tell us.
And report out to the. Don't everybody look at each other.
One
Cause
person
I
try
will
to
appoint somebody. I will appoint somebody in a heartbeat.
Okay, so which one's a lie? Okay. Teresa?
You gonna write and report? Okay.
Only check.
Somebody to write.
I get a prize. Okay, next.
All right, let's deal with the temperature first.
Okay.
Anybody else in your code?
So which one writing a comment?
Well, write them down first. Then we're gonna discuss, then we're gonna agree to what we're gonna report out, okay?
Speak up a little loud so we can hear you.
All right, so write them this. And once you do your myths, draw a line and write the facts.
The
All
line
right.
says it's not about that.
Myths and facts.
Next.
I have 4 grandchildren. I am married.
I'm ready to cut this out.
Not bad. Okay. Okay, next.
In about 15 minutes, we're gonna have a
I can see instead of trying to find an easy solution, we all have to unite and think about it. We want our tax money to come back to us.
Yes.
That's
right. Maybe 40 years.
And that's what we're doing right now. We're trying to solve problems. Meanwhile, we're heading to
So the second part is the lie.
Some of us have lived that long.
going back to finding individual solutions. Why do we have to beg of our tax dollars being used for something else? And I need to say this because I'm surprised
You got it.
our infrastructure breaking down, toxic chemicals.
Okay.
People homelessness, environmental pollution.
I'm a former motorcycle racer.
I'm in already done.
I was a former Air Force Academy cadet at Colorado Springs. And I was an ex-parliamentary assistant at the European Parliament in Strasbourg.
It's never gonna work because we don't have, it's never hard.
Yeah, first.
I started riding a motorcycle, I got in an accident, so I'm no longer a motorcycle.
Who got that right? You got 2. That's a phone. You got, okay, now, let's get into the leading, what are some of the leading factors that cause homelessness? I'm gonna do this right. What do you think are some of the leading factors that cause homelessness?
Okay, so let's put our list of
What are
big
some of the
first.
reasons why people
Yeah, however you want to do it.
All you have to do is like, stand up and say, Mayor, you've got to address poverty. Because poverty is the root of crime. Poverty is the root of homelessness. All right? Poverty is the root of
Call them out.
of
What's the
violence,
list?
of despair.
Look at what you got.
Okay, so we need to advocate for.
low income?
Lazy.
Low income. Which one?
Over again, and no, it's the type of insanity. Changes.
What else?
Alleviating.
What
How about, because this is what is the root of.
Want to be.
Yeah. But, exactly.
The other myth is that all homeless just means you're leaving, living in a tent.
What are some other factors or reasons why people are homeless? Okay.
All right, politics is not democracy, it's a distribution of resources and power. You don't see that way.
Tents or on the parade somewhere. Yes, mentally ill, all mentally ill.
So you see all these things, what else? There's a whole laundry list of reasons why people are homeless.
Yeah, we said like just go get a job.
That lazy, that has a lot to do with it. That lazy don't want to work. That's a fact.
It's sort of like all of these, there's a little bit of this in the past. It's not that it's always
Diagnosis,
a simple solution.
facilities or mental health resources in this community? So lack of mental health resources? Not enough.
It's just adults.
Putting band-aids on cancer, I can tell you, it's never going to work. The patient will die.
Why are people homeless? What happens if somebody loses their job? Also, say so. What about when a man is the breadwinner?
You say easily identified.
Right? Lost.
Sounds good to me.
When you're recording, you know what it is. Yeah, that's good, that's good. Yeah.
What's the most? Because people do what? Couch surfing. After they couch surf
What
for
else
about
do people think about when they think of
a
homeless?
month or so, then the family members say, they got
This is
to
like
been laying on this couch.
They're unloved. Unloved.
And then no family.
I'm old school.
Oh, yeah. Anything else? That we can add to our list? Yeah. What about physical disability? We talk about that? Physical disability? Anything else? What about transportation? That's not a cause for homelessness? Can't get to work? Lose your job?
One more thought about
Yes.
gentrification.
You get ready to give.
Conversation wrapping up.
Yeah. 2 more minutes.
Excellent, love it.
2 more minutes, folks. 2 more minutes. 2 more minutes.
Unemployment. You see anything about prison? Prison reform? How about the fact is that there are homeless? There are homeless now. Low income. Anything else? Here's my list. Anything else? Everybody okay on the list we got?
Misuse of public funds. Because sometimes there's a lot of money thrown at homelessness, but it's not always used most efficiently.
Waste, fraud, and abuse.
Or misuse of public funds.
And then some people like to say low wage, some people like to go to be able to pay some people not enough to rent, and maybe before the market where they might be doing it
Sometimes there's money, but it can be used in ways that are not as effective.
some places where you live, each year they go up.
Already in like a housing recession or whatever, and they take advantage. You know, do they tell the rent is keep it out or whatever. It's called affordable.
Yeah, one more. Heard about the homeless this text of GBGK. Okay, so catch up.
One more minute. One more minute.
Housing discrimination, they discriminate against homosexuals, lesbians, African Americans.
Larger families have larger families.
Anything else?
Larger families,
That's pretty.
You only can have
Came up with 21 reasons, factors that cause, these all cause harm. Okay? All right.
All right, I think we're going to come back together, y'all.
30 seconds. 29, 28, 27, 26, 25, 4, 3. You all finished over here? Ooh, heat. All right. You all
All right. Sounds like we had some great conversations. Thank you, everyone, for participating. We're going to start with group one, whose question was, what are the leading factors that cause homelessness? And whoever your speaking out person is, if you can speak loudly, that's great. If you want the mic, you can come on up here otherwise.
Okay, again, we talked about what are the leading factors or leading causes of homelessness. And we listed all the factors that we could think of, and we came up with about 22 factors that cause homelessness. And we started off with the fact that, you know, some people just want to be homeless. Number two, lack of affordable housing. And that was one of the main reasons that we talked about that. Bad or no credit, no income, low income, unfair equity, criminal record, lack of education, drugs, mental health issues, and lack of mental health resources to correct those issues, poverty, zoning laws, domestic violence, another major leading cause, loss of a job or loss of a spouse, the breadwinner, unemployment, again, low wages, lack of family support or family assistance once you have searched for 2 months, housing discrimination, racial inequity, inequality, physical disability, transportation, gentrification, and misuse of public funds.
All right, great. Thank you for that very long list. Any of those that you wanted to like talk through or explain more, or do you think they're all pretty self-explanatory?
Well, the biggest one that we talked about, and I'll go back to that, was is the issue across the whole region is the lack of housing, the lack of affordable housing, and also the fact that the housing that we do have, we've got to do a better job with landlord engagement. So that's a big piece that Region 9 needs to work on, so that we can kind of convince these landlords to rent these apartments and these homes to our homeless community.
Thank you so much for that. I really appreciate that. And on that note, I think like most of the things that you've highlighted, a lot of the things you've highlighted are kind of like systemic issues, right? I think a lot of times the conversation around homelessness tends to center around the person, or like what did they do that led them to this situation, whereas looking from that systemic lens around affordable housing and how we can advocate for that, I think that's always really, really key to the conversation. So thank you. Group 2, as we're being blasted with heat right now. All right, common myths and facts surrounding homelessness. Go for it.
Common myths, you'll see that as we get to our facts, a lot of our facts will sort of mimic a lot of what the causes of homelessness are in our community. But we started with myths. We started with lazy. A lot of people have the thought that homeless people are just lazy and they just don't want to do anything. A big one, I think, would be drug addicts. I think that a lot of homeless folks are just drug addicted and they're on the street because of their own drug addictions. We talked about criminals. A lot of people think homeless folks are criminals or dangerous. TV plays a lot into that. When you see, they depict homeless folks on the street as the one that maybe murdered someone, but in reality, these are the smallest percentages of our folks that we work with every day. Our runaways, myths that a lot of the homeless are runaways. All homeless people live in tents. She brought this up. This is a good point. A lot of people think all homeless people live either in tents or on bridges or the ones that you see on the corner holding the signs. And one thing that I do remember when I spoke at a school once about homeless children and homeless, a lot of people don't realize that, and it could be even in this room, we literally could be sitting next to someone that's homeless, because homeless is not that picture that we paint. Homelessness is that the fact that we just don't have a home to live in. I'm going to stay at a hotel tonight until I can access housing. So homelessness has different faces. It's not just that what we see on the street. One of the others were all are mentally ill. Of course, there is a portion or percentage that do suffer from mental illness, but again, the myths are is that the majority of homeless people are mentally ill. Just go get a job. You hear people say that all the time. They won't give money to the people that are on the corners. If they just go get a job, they won't be homeless. It's not that easy. Simple solution. Again, those two go together. Go get a job. There's a simple solution. Get a job, you won't be homeless. Just adults. Adults are not the only homeless people there are homeless children. We talked about the number of 22,000 for the state of North Carolina as a whole. I don't know the numbers for Rocky Mount. I do remember that National Rocky Mount Public School System has numbers that identify the number of homeless children in our communities. And back 10 years ago, it was well into the hundreds, 200, 300, 400. Don't know where it is now, can't speak to that. But my assumption is that it's still in the hundreds because we just haven't done the jobs that we needed to do to eliminate homelessness in our community. Easily identifiable. Again, people think that homeless folks are easily identified because of the way that they look and the way they're depicted. Uneducated. Some of the most educated and intelligent, articulate people that I've ever met were homeless people in shelters, men and women. So we just want to do away with that stigma. Dirty, smelly. You run into those individuals, but again, that's some of the smaller percentages. Unloved. A lot of people think that when you have homeless people, they're unloved. They have no family support. They're loners. They have family. They've just gotten themselves in situations, some of them, where they haven't been able to contact their family. Family may live in Colorado, just can't get back to that family. If we could bring programs that can help them get back to their family, then they can get that love that's needed, that's there for them. Facts. Some of the facts of homelessness, again, lack of affordable housing, lack of child care, lack of transportation, low income and wages. These are, again, just facts as to why and what folks are homeless in our community. People just fall on hard times, domestic violence, you guys mentioned that. No support system, illness or disabilities can on both sides. It could be an issue on a person is homeless, but a fact is there are folks that have illness and disabilities. Education, lack of education, prison reform, there are homeless families. Is a fact there are homeless families, not just individuals. Lack of resources and inflation of rent. That's a big one. That goes hand in hand with the lack of affordable housing, because when there is affordable housing, you guys mentioned gentrification. then houses either become out to, they're not able to be attained by the populations that we serve, or they're not even available to them to even have that option. And then larger families are hard to place. Those are some of the facts that we came up with for common myths and facts surrounding homelessness.
Great work, group 2. Thank you for that. We appreciate it. It's always hard for me to hear those myths because I think that's kind of the public perception, oftentimes, right? Kind of the general person you passed and walking down the street, that might be something they say about folks who are homeless. I think it's our job as advocates as well to educate the community around what the actual facts surrounding homelessness are, and that there are these individual factors, but oftentimes those are just myths and things that we assume. So I appreciate you elevating those. All right, we'll move to group number 3. What have you seen as some solutions to homelessness in your community? Let's talk about good things, right? Let's talk about resources. Let's talk about what we can change.
All right, so what we have seen as some solutions to homelessness in our community, and I'm just gonna list them all, but we'll hit on, maybe a few important factors for solutions. So the first one would be credit repair being raised to 600. Number 2 would be group homes, shared living, and this would be good for seniors. And then that would segue us into moving seniors to senior housing, moving from nursing homes to actual housing that they can, specifically live in. Number 4 will be tax money to come back to help our citizens. And this is one that I will kind of elaborate on a little bit, but let's keep going first. So number 5 would be community advocates, okay? And 6, for the mayor to address poverty. Number 7 being political involvement. Number 8, education and job training. Number 9, to reduce housing costs. And number 10, employment and income. So I'll go back to number 4, tax money to come back to help our citizens. That was something that we really, as a group, we're very passionate about. So we understand, money's being sent over, to help other causes, or wars are being funded. Our money as taxpayers are going elsewhere. So if we can take that money, the majority of that money, and put it back into helping, the homeless people that we have here, in each community or each state, each neighborhood, that will make a huge impact. We're spending billions and trillions of dollars funding wars, and other activities, but if we can just take even a piece of that money, yes, we do have money that is set aside, but those are small pieces, and if every organization, we're all doing our part or doing what we can individually, but if we can actually take a massive amount of money and put it back into the community, that will definitely help. And community advocates, everybody, or, just here at this table alone, and I'm, all of you all are wonderful, and I want to thank each and every one of you all for the part that you play in the community. But there's different organizations here, you all are representing an organization, but most of you all are standing and fighting for, and advocating for our people, us, as a whole. So if we can rally together, come together, instead of doing little piece here, little piece there, just come together as one big community, we can definitely make a greater impact. There was a note for the mayor to address poverty. You all know poverty is really a big root of why so many people are homeless. So if the mayor can address poverty, and if we can just, and I may, if Dr. Koo can speak a little bit more to that as far as poverty is concerned.
Okay.
There we go.
I just want to say that I'm trying to put this in a bigger picture, right? In the sense that we're all talking about crumbs, all right?
Yep.
And that's why I was saying to her and in our group that all of us tell the government, the federal government, we don't want our money spent overseas anymore. We want it to come back to us, right? For infrastructure, for poverty, for stopping hunger, for healthcare, for public education, for housing, then we won't have a problem, right? It takes $1 trillion to get rid of all the debts in the US, right? Rising student debt, mortgage debt, and all that, right? And it takes $12 trillion for them to send to Afghanistan. 20 years of war, and what do we have? Nothing, right? More poverty in Afghanistan. We have more poverty here. So I'm just saying that while we individually are fighting for crumbs and jumping through the hoops in order to get these little crumbs, why don't we all together say to the government, no more, give us back our money for our development.
Yeah.
Right? I mean, it's so obvious, right? And yet, you know, everybody's divided into little agencies and individuals fighting for, oh, this and that. I'm not saying that it's wrong for you guys to do that. I'm just saying is that it's like running through this treadmill.
Yeah.
And it's never going to end.
Yep.
Right? Meanwhile,
Yep.
you know, you say, for example, Jeff Bezos gave a sum of money to the organization. That's great. But guess what? Jeff Bezos didn't pay his taxes. Right? We all know that. Big corporations don't pay the taxes that they should. Right? They went to safe havens, they went to all these, and then they paid crumbs to the government. So we got nothing. Well, we are being made to pay taxes. So I'm just saying all these facts shows that there's something wrong with the way our system is working. So let's make it right.
Absolutely.
So that we get the money back. And
Absolutely.
the recent thing I thought about the mayor is that he came up recently in his, I'm the mayor of Rocky Mount, right? Bless his heart. Right? He came up in the city of Rocky Mount, the state of the city speech, and he said, my top priority is public security. And I'm saying, that's so wrong. Your top priority should be alleviating poverty in Rocky Mount, because that's the root of all the crime and violence here. Now, if you don't believe me, ask yourself, why are people going into guns, into crime and all that, right? A lot of them are desperation, just desperation, hopelessness. Why are people into drugs?
Yeah.
Hopelessness.
Absolutely.
They want to escape, right?
Mm-hmm.
So I'm just saying that let's turn around and do the right thing. And see things for what they are, rather than pretend that this is this is that, and then fighting for little crumbs.
Fighting for crumbs. Thank you. I think, thank you. I think we need more politicians with that mindset, if I can get a little political up here. But one thing, and it's small, it's going to take forever to make these changes, but the National Low Income Housing Coalition, NLIHC, does some really great work around affordable housing and advocacy. They actually have an opportunity this week, and they do this often. And I do this, I'm saying this because it's really easy. Sometimes it's very, for me, intimidating to like talk to my representatives, right? Or like send them a note that's like, hey, care about homelessness and housing. It's like, what do I say, right? But they actually send you like scripts, and they send you emails that you can just copy and paste and send to your representatives. The more of us that are sharing this message, especially at the federal level right now, they're making a lot of decisions about the budget right now, and a lot of that could impact affordable housing and our folks who are experiencing homelessness. So send those notes to your representatives, talk to your mayor, get in front of your city council. And this is we're gonna talk about this as we get into like what comes next, right? Take that energy, take that passion and that motivation to make that change, because ultimately all of the changes we've seen throughout this country come through grassroots efforts, and they come through people who need to see change. And that's you. That's you all in this room. You have power. We have passion. We have knowledge, and all of that can speak volumes. And if we don't stay quiet, people are going to have to start listening. And I know that we've been fighting such a long fight around this, and it's not going to be easy, right? So I appreciate that, and keep that motivation and that passion, because it can be so easy to lose that quickly. But I appreciate y'all participating in this, and hopefully you've learned a little bit. Hopefully this is starting to get some more gears turning. Hopefully y'all stay for lunch as well so we can have more good conversation about what resources are in the community, how we can support each other, the changes that we can make together. So I'm going to shift a little bit more. This is a little bit more around kind of, what we can do and what kind of resources we can access. So I'm going to talk just a little bit more. I kind of already shared this, so I won't belabor it by any means, but just talking about the federal assistance that we do have, which are our little crumbs, which you're so right. And I'll leave it at that. But so the continuum of care funding, so this is a nationwide competition. So I've mentioned the COCs before. There's over 400 continuum of cares across the United States. And every year, the COC competition is between those 400 COCs. So you're literally ranked from COC number 1 to COC 400 some. And based on how you rank is how your funding is allocated and how much funding you get. So we have a pretty pressure-filled job to make sure we set forth a really good application every year to make sure that our community gets the funds that they're being allocated. Those grants are administered directly from HUD. So we have local agencies that apply for funding, and our COC applies essentially on behalf of those agencies for the full funding. So those grants then, whichever agencies are funded, they have a contract directly with HUD. So we don't actually contract with the agencies. The funding and the contracts and all of the administrative pieces are directly between HUD and that agency. Eligible activities, so what you can apply for through COC funds, are permanent supportive housing, which is that long-term subsidy and supportive services program that I had talked about. Rapid rehousing, which is a short-term rental assistance program with supportive services. Supportive services only, which for our community is essentially coordinated entry, which is how we coordinate services across every region and make sure households are swiftly connected to housing, are able to access resources, and they're prioritized and then connected to those resources. So it's exactly like it says, but it's a coordinating role. And then there's also a joint transitional housing and rapid rehousing, which is really just kind of a carryover and a grandfathered in program. Back in the day, HUD used to fund transitional housing often, but a lot of research came out around transitional housing, how it is more expensive than a lot of our other models and doesn't always have the great success rate that we're hoping for, i.e. people getting into permanent housing. So HUD has actually backed away from funding transitional housing and now mostly focuses on rapid rehousing and PSH. So this joint transitional housing, rapid rehousing is kind of like a quasi both of those programs, but we don't have any of that within balance of state. So that's kind of a moot point right now. And then HMIS can also be funded through the COC program. So our data center receives a grant to help administer HMIS. Quick HMIS plug, if you are an agency who's serving in this community and you serve folks who are homeless, you're not on HMIS, it's free to join. And it is a great way to participate in the community and ensure our data is more and more solid every year. And then the Emergency Solutions Grant Program, we've talked about that quite a bit as well, but that is a block grant. So we are under the state portion of that grant. And then there are 6 entitlement communities as well, including Raleigh, Wake, Charlotte, Durham, Forsyth, and Greensboro. So we're kind of within that state allocation. Grants are administered by the state or the entitlement. So in our case, it's through Chris's office, through the ESG office, and eligible activities are street outreach, which is just like it sounds like. We're going out to the streets, we're meeting folks who are experiencing homelessness outside, and we're getting them connected to resources, to housing, helping assess them, make sure that they're getting, if they want to get into shelter or they're looking for other resources, providing that support. And then emergency shelter, which again, as we've talked about, is more of a short-term interim housing option. Rapid rehousing is also eligible under ESG. And then there's a prevention category, which I'm not going to try to explain very much because it gets very complicated, right, Chris? So prevention is a very specific time frame for ESG, but is very important, right, when it comes to helping folks stay housed and avoid that eviction on their record. And then HMIS is also eligible under ESG. So that's a little bit, again, about the two kind of big funding sources that COCs and NCCH, our balance of state, help facilitate. I'm now going to turn it over.
Can I ask one question?
Yes.
You were saying that there were over 400 continuum of care programs in the U.S. Just out of curiosity, where do we rank in that? And is there also a structure for not just competing against one another to rank higher or lower in that, but is there a structure to actually advocate for more, what can I call that, cooperation and raising of funds? Because like you were saying, I know that the budget, the federal budget that determines what we can actually spend in that budget, most of that spending is, I think it's something like, should be around 60% is spent on military spending, and everybody's probably heard we're spending $113 billion for some faraway war in Ukraine, and we're looking at crumbs on, and people are fighting one another. Basically, that's what it is. It's competition to how much you're going to get in the different 400 groups of continuum of care. So is there a structure to actually advocate and cooperate for more funding for homelessness?
So because the federal government is decided upon by Congress, it's all about advocacy. I don't have a great answer to that, but all I could say is, could you imagine if that was flipped around? If military got $2 billion and we got hundreds of billions, like what we could do with that, right? There's a lot of things that have to change for our competitions to change because it does come down from that federal level. Even our office that we have close contacts with, like they feel like they can't make a lot of change. So I think it really does come down to folks in the offices. I mean, the HUD secretary, Marcia Fudge, love her, respect her. There could be a lot of different decisions that are made from that office as well, right? We have an administration right now that I think is open to change and would advocate for additional funding, but there's a lot of political factors that go into that. So
Where do we rank in that?
we rank fairly well, actually. Balance of state this year, I can't say the number we were, but they give you like the average score, and we were well above average. So I would say that's one thing that we're pretty strong at in balance of state is having a really solid application. If you ever want to read it, it's about 500 pages long. It's real fun. So obviously that's tongue in cheek, but I mean, I would say that we do fairly well as a continuum of care. They give you like about 95% of your allocation kind of automatically, and then we have to kind of gain that additional other amount, plus there's bonuses that are available. So again, it gets very complicated, but we know what we're going to get for sure, but then we can have an opportunity to get more. And every year we have more applications than we have funding that we can fund. So every year we're having to cut programs off. Yeah.
Can I just correct you that the military did not get $2 billion. They got over 800.
No, we get $2 billion. Yeah,
The
yeah.
military got over 800 billion, and last year they got over 700 billion, and this year they got over 800 billion. So every year, the funding for the military
It's going up and we're going down.
and we're going down.
Going down. Yeah. Chris.
I have a question. The two parts of funding, one from my office, the ESG, and then the COC. This region, our region, Region 9, we access the ESG dollars. What are we getting for the COC?
COC.
Funding
Yeah.
COC.
So I'll reference back to, there's the permanent housing inventory. There's no numbers on these slides, so that's not helpful. But Community Link has a permanent, so let me back up. COC funds are harder to track because with ESG, as you know, we have actual per region fair shares. So if it's $200,000 in Region 9, we know that Region 9 has $200,000. But with COC, agencies like Trillium, that's an LME MCO, they don't cover Regions 10, 11, and 12. They cover these 3 counties in this region and those 4 counties. So they might have a PSH grant that covers their catchment area, but it doesn't cover like full regions of balance of state. So it's hard to nail down. And usually those programs are serving larger communities. We've got gaps in our smaller areas. You mentioned Northampton, like that was one that kind of was just handed off to you because that was more convenient, right? And so it can be really hard to kind of quantify, but Community Link, they have a PSH project that covers a portion of Region 9. East Point Human Services, again, they're an LME-MCO. They have 2 different PSH projects that cover portions of Region 9. We have, this is not a COC or ESG, but Volunteers of America covers all of Region 9 with their SSVF Rapid Rehousing Project for veterans. And then we recently, the Reach Center has a COC grant. Do you all cover all of Region 9? You just make that one easy. Usually it's PSH that gets a little bit more complicated. I do have, just for my own personal reference, like all 79 of our counties and then the breakdown like per county. So I'm happy to send that out too. That just shows for Region 9 kind of which county can actually access what, because it gets confusing. It should be easier to be able to quantify, but it's not. All right, I appreciate that. I'm going to hand it off now to Miss Cornelia to share some of our local resources.
Good morning again. For its local funding to end homelessness, the city receives annually community development block grant funds, and roughly a little over $500,000 that the city has been awarded in the past few years from the federal government, from HUD, and 15% of that allocation can be used towards public services. And those public services dollars, that 15% percentage of the allocation of CDBG dollars can be used to partner with local nonprofit organizations like many of you in the room. And what we normally do, we issue a request for proposal, and organizations, nonprofits, will submit their request for proposal to our organization. And then from there, we award those proposals with fundings sources to assist with addressing some of the services needs that you're trying to provide. One of our focus areas or priority is homelessness for us using those public service dollars. Some of the organizations that we have worked with those with providing those funds have been locally United Community Ministries, house the children at the Bassett Center, United Community Ministries Community Shelter. We've also partnered with the Ripple Effects group, with Ms. Fivey, with the Project Bridge program, with their transitional housing. In addition, we've partnered with Lighthouse Home. I believe we have a representative here, Ms. Vanessa, with Lighthouse Home, which provides transitional shelter to women who may who've had addiction issues or concerns, or even with someone that's been involved with sex trafficking. We've worked also with My Sister's House, with their safe house, with providing rehabilitation services to address some of the needs, housing needs. So that's one stream of money. Normally, in the past few years, we have issued those art requests for proposals around April. This year, it will most likely be in the fall when we issue the request for proposal. Keep in mind that HUD is on a different fiscal year than the city. The city's fiscal year runs from July 1 to June 30th, and HUD's fiscal year starts on October 1st and ends in September. So normally we receive the federal funds from HUD somewhere around October. So there will most likely be a request for proposal that would be issued around September. So it's very important that if I don't have your contact information, please make sure before you leave that I do have your contact information so that I can include you on the mass email that we send out when we issue that request for proposal. In addition, we advertise it in the newspaper. We also advertise it on our website. In addition to the community development block grant funds that we receive, we also have been awarded CARES Act funding through the federal government. We were awarded a little over $638,000 to support addressing coronavirus, the pandemic. And as a result of that, we have set aside nearly maybe half of that amount to go towards public service organizations. And this particular fiscal year, this current fiscal year, we have awarded roughly about $267,000 to local nonprofit organizations. And half of that amount went to addressing homeless prevention through partnering with some of the local partners that are sitting in this room right now, the Mercer's Foundation, United Community Ministries, Ripple Effects, the Right Center. Those are some of the organizations that have received funding from us this year. And we look forward to issuing a request for proposal later this fall for the CARES Act funding. We do have some funding that is remaining, but we are wrapping up that specific grant. I believe we've expended today roughly a little over $400,000 towards the CARES Act funding, which went not only to public services, but it also went towards assisting with emergency rental assistance, where we partnered with Rocky Mount Edgecombe Community Development Corporation to provide emergency rental assistance so that families could continue to live in their homes. And we provided up to 6 months of rent. In addition, we've partnered with the Mercer Foundation to support the emergency rental assistance efforts as well here in our community. We've also partnered with the Mercer Foundation and also Joyful Hope Station with providing food pantries or food distribution assistance. And so those are some other things that we've done. And lastly, we've partnered with small businesses with those CARES Act funds to assist with businesses that have been impacted by COVID. Now, all of those funds have been exhausted, the small business assistance funds. In addition, the city, as well as the Downey's Home Consortium, has submitted a work plan to HUD for the Home American Rescue Plan. Those funds would be used to address families, individuals who are on the brink of being homelessness. The Downey's Home Consortium was awarded a little over $1.4 million to assist with homeless prevention. And some of you in the room have also participated in some of our roundtable discussions regarding that. So we're waiting to hear from HUD regarding that plan. But in that plan, it was proposed to set aside at least 4 to 5 rental units would be constructed, where it would be a construction of new housing that would be used. Now, those funds we have until 2030 to spend. We'll be looking for a developer, a partner, a private entity to partner with, in addition to maybe a local nonprofit to partner with and contribute, who could bring more more funds to the table so that we're able to construct more homes than just 4 homes with the homes that are set aside or being proposed in the home ARP work plan. There is a set aside of roughly a little over $200,000 to partner with local agencies who work with or provide assistance addressing homeless prevention. So there's that pot of money that we hope to have approved from HUD, hopefully by the spring or summer of 2023, so that we're able to move forward with that. But those are some of the local funding sources that we have available, and those funds are all from the federal government. Any questions regarding the funding we receive locally from HUD? Okay.
Expound more on house restorations with the funding?
Okay. So are you speaking of for as the assistance for as with the home?
Yeah, how to restore your house.
Right. So in addition, our office does have funding that we have set aside that comes from the federal government, but also our general funds support our 4 housing programs that we currently provide assistance. Those programs are geared to more of individuals that are owner-occupied, meaning they own their house and they live in the home. Those programs are the urgent repair program, the housing repair program, the workforce housing repair program, and then we also administer a program called the Housing Rehab Matching Rebate Program. That program is a little bit different. That program actually reaches not only homeowners, but investor property owners who don't reside in the home, but they have tenants that live in the home, or maybe they're trying to market the home for a particular tenant to occupy the home. That particular program is fully supported and funded through our general funds. So those are the 4 local housing programs that we presently administer. I'm hoping that answered your question. And then we have the home program. That is a program where it's more focused on doing more of a full-blown rehabilitation to the home. And that program, those funds come in through the Down East Home Consortium. And the consortium is comprised of 9 municipalities here in the Twin County area. The city of Rocky Mount is the lead entity for the Down East Home Consortium. So we administer those funds and the program on behalf of the consortium. And so the city receives a little over, this year's allocation was roughly about $460,000 in home funds that the city receives. 10% of those funds are set aside for administration and planning. 15% is set aside for community housing development organization. And our local certified CHODO, or Community Housing Development Organization, is Southeastern North Carolina Community Development Corporation, which is Mr. Kevin Macklin's group, which is kind of an arm of the Rocky Mount Housing Authority that we partner with. And then lastly, the remaining of those funds are used throughout the Twin County area with those jurisdictions that are affiliated with the consortium to provide rehabilitation to owner-occupied units.
One question.
Yes.
The CARES Act funding that you mentioned, you have remaining dollars that will be, I think you said the RFA will go out in the fall.
That is correct.
How are you planning the notice, will that notice of availability be? Would that be an announcement or?
So it would be an announcement. Normally it will be an email announcement as an email blast. So please share with me your business card today, and I'll make sure you're included. It will also be published in the Telegram, the Rocky Mount Telegram, on our website. And then normally, we have flyers and information that we disperse to all nonprofit entities. But one way of making sure that you are aware when that request for a proposal go out is to make sure that I have your contact information, and then you'll get an email specifically from me, directly from me. Yes, sir.
I was wondering if, what we've talked about, a lot about housing and urban development as a funder. Is there a partnership here in Rocky Mount with the Veterans Administration? Because if I remember well, I think it was something like 1 in 8 of the homeless are veterans also.
Right.
Is there that partnership in place yet or not?
We do have a partnership with the Mercer Foundation that provides assistance, having a house that's designated for veterans. So that's one of the things that we are doing. We're also in the process of looking at crafting a policy that would be a housing rehabilitation policy, which would be a new policy that would be geared to assisting families, particularly seniors and disabled individuals and veterans, with assistance, rehabilitation assistance, where it would be a full-blown housing rehabilitation assistance. Now, that is a draft policy that's in the working. It hasn't been presented to our city council yet, but that is something that we are looking at focusing on. But one of our current partners right now is the Mercer Foundation. Any additional questions? And one of the other things that we're looking at with our home ARP funds that the city of Rocky Mount has been awarded, $3 million of it has been earmarked for affordable housing. $1.5 million has been allocated towards site acquisition, and the remaining $1.5 million has been set aside towards going a portion of that down payment assistance program. So we have the city already has a CDBG down payment assistance program, but we're also trying to have an enhanced down payment assistance program where it would reach out and expand, where it would go up to workforce housing households, but it would be specifically geared so we would be able to layer down payment assistance funds to help someone with acquiring a home that's low to moderate income. So that's another policy that's out there that we're trying to, that's on the city manager's review, upon his review, and if we hope to get his blessing so it can move forward to the council, where there's funding set aside through Home ARP. In addition, there's some Home ARP money set aside for just our regular housing programs, and that's why we're trying to see if we can get a full-blown housing rehabilitation program, because what we're seeing is there is a great need here for more of extensive repair needs to homes, and the programs that we currently have would provide assistance with maybe 1 or 2 repairs, and so that's not really maybe addressing the need that we need. So we need more of a program that would address our needs more if we're wanting to improve our housing stock of our existing homes, because not all homes we want to tear down. We want to be able to restore some of the older homes, and so that is our goal. One of the things that we're looking at a program that's North Carolina Housing Finance Agency has a program right now where there's an opportunity where we could submit a grant through the SHARP program, where that would focus on providing rental housing assistance for families 50% or less of the area median income. So that's an opportunity for us to look at affordable housing and focus more on the extremely low income to low income. And that program is geared more to addressing homelessness, providing a permanent housing source. So that is a program that we're looking at considering to apply for as a grant through the North Carolina Housing Finance Agency. I believe that is funded through HUD, through American Rescue Plan funds.
In developing those policies for the veterans and the elderly for housing, are those meetings going to be open to the public when that is, when you're actually trying to get the policies in order?
Yes, so the public would have an opportunity. Let me just back up first. There have been a series of community engagement sessions for the American Rescue Plan funds that took place last year in the fall and winter, where there were a series of sessions, I think maybe at least 10 sessions or so, where the public had an opportunity to come in and voice their concerns of how these funds should be spent, that are remaining $5 million that has not been set aside and allocated. And so we're also eagerly waiting to see if we will be awarded additional affordable housing funds, and which we all know that there is a dire need for affordable housing units here in Rocky Mount. I've heard that in the various conversations today. And so we're eagerly waiting to see if additional affordable housing funds would be set aside to help us to address our affordable housing concern. Just to make you aware, one area that we're starting to work in is the Beale Street area. The city some time ago did phase 1 of Beale Street, and we're anticipating this summer to start a phase 2 Beale Street. And that is going in and developing the remaining 36 parcels that are not developed. And we're anticipating that to take place very soon, where the Redevelopment Commission and the City Council will meet and discuss that agreement and partnership with 2 potential developers. And so that's one development. And so where there will be a combination of single-family housing units, but also duplex units that would be affordable for renting. Okay, I'm going to turn it back over to Ms. Alley.
We're keeping you past lunch right now, so I'm mindful of that we're all hungry. And I just wanted to, maybe next slide, just provide some resources to leave y'all with. And this is not in your packet, so I'll make sure this information is sent out. But just really want everyone to know like the ways that they can get involved in the community. Joining HMIS, I've already talked about that a little bit. Again, talking to your elected officials, volunteering. Region 9 through the COC has monthly meetings. They also do coordinated entry meetings to work through the by name list of folks who are experiencing homelessness and getting them connected. So just really want to, challenge folks to get involved, to be a part of the conversation and the solutions. And then also educating ourselves, right? Becoming familiar with evidence-based practices, understanding the difference between the myths and the facts around homelessness, learning about local and federal programs that are working. I heard the desire for like a local community resource kind of packet. I think that's a great idea, just being able to reference that as providers. And then there's so many resources out there, but one thing I like to do is get on all of the like listservs of different agencies. So our ncceh.org, it is a little bit of an overwhelming website, but there is a lot of resources there, including our point in time data, more of our local data, information about HMIS, all of our programs that we run. The National Alliance to End Homelessness is another really great resource. So endhomelessness.org is their website. I would encourage you to go there, sign up for their newsletters, get their information. They do 2 annual conferences as well that have gone back to in-person. The one in July is always in DC. So that's it's a little expensive, but it's a great opportunity if your agency or you have the means to participate in that. And then HUD also has a homelessness assistance webpage. There's a lot of resources there. It can get a little overwhelming. So if you ever want to connect and have deeper conversations, if you ever need anything from NCCEH around data or facilitation or just support as a community, please don't hesitate to reach out. I will make sure folks have access to my contact information question. And if I don't have answers, somebody at our agency probably does. We've got a lot of really smart folks at NCCEH. So I just wanted to say, again, thank you for the opportunity to be here with you this morning. And it's just such a pleasure getting to meet some of you in person. I've been on many virtual meetings with many of you, but being here, seeing the community and just feeding off of your energy and passion is really exhilarating. So thank you for having me, and I wish you the best.
Thank you, Ally, so much for coming today, and thank each of you for coming today. We know that this event could not have been a success without the support and involvement of each one of you in the room. I also want to thank Ms. Loretta Braswell for coordinating this event and taking the lead with coordinating the efforts. Let's give her a round of applause. I want to thank the community development staff and the human relations staff that are in the rear. Before you leave, I would like to ask that you complete the evaluation form that you have on your table in front of you. It's very important that we receive your feedback. We value your input. We want to know what worked well today, what didn't work well, so that in the future, we can look at how we can improve. If we did great, let us know we did great. But thank you again. I believe we have boxed lunches in the rear of the room. Please stop by before you leave and pick up your boxed lunch. Also in the back, there is information, bags, pencils, and other goodies, outreach incentives. There are brochures about our housing programs in the rear. At this time, before we conclude, Ms. Loretta Braswell would like to share some information on our last community development event for the month.
We want to give you all a hand for being here. Okay, this week we will end our Community Development and Fair Housing Month, and we're doing a big celebration. You know, we have several wonderful housing programs, and if you will pick the information up on the table, you can learn about our different programs. But we are going on a tour. We want people to see what we have done, what this wonderful staff and what Human Relations has done to repair some houses. And we're going on tours, and if you would like to be on that tour, we have a form for you to fill out, and we want you to select the time, Friday and Saturdays, from 9 to 11, 12 to 2, and 3 to 5. And that means you go all those hours. The first 2 hours, then we're going to put you off the book. Well, we want you to come about 30 minutes early if you can. We'll meet there at City Hall. The buses will be waiting. And we're going to give you a little snack to eat before you go, because you can't eat on the bus. So come on out about 30 minutes, whichever one you select, and we'll be glad to have you to show you the different houses that we have rehabbed. And there's some happy folks in those houses. They are. So go on and fill these out and get your lunch. And we are sorry we have to share this area with some more people. They're waiting for their lunch. But if you will get your lunch and fill out one of these and give them back to you. Any questions? Thank you so much. Love all of you. Love you.